I'm Sandip Patel. I'm an MD medical oncologist here at UC San Diego Moores Cancer Center, where I focus on early phase clinical trials of new immunotherapy, including solid tumor cellular therapy, as well as thoracic oncology. I think those of us that take care of cancer patients already have a very intense practice of dealing with a very severe disease. And to have that compounded by the COVID-19 pandemic has been transformational to practices, not only in terms of keeping patients safe, which I think we all think is paramount, but making sure the doctors, nurses, frontline medical staff are also able to be taken care of so they don't spread to other patients or to their own families. And so I think this is unique in that measure. And really, we deal with the annual flu seasons for which at least we have a vaccine. This really has transformed the landscape completely and has led to a need for a lot of process improvements. I think what's really helped is allying our practice with a broader health system in terms of making sure patients are safe and providers are safe in terms of testing, in terms of if a provider gets sick, they can get the necessary real-time PCR and now antibody-based testing for COVID-19. Utilization of contact tracing technology to make sure we utilize these resources as well. Most importantly, having PPE available. If you're a frontline provider, especially in the ER and the ICU, you're rounding on the inpatient wards, having the necessary masks to take care of patients and also knowing their status going in. I think all these aspects have been huge in terms of how they've affected our practice. I think the other point is how we've started to integrate these changes in terms of telehealth. Now, many practices and many groups have already implemented telehealth, and there's no time like a crisis to implement these wholeheartedly. And so, at least in our system, utilizing telehealth for both inpatient consults as well as outpatient visits is something we've tried to do. And it's been a learning process, at least in my own practice, in terms of how to do this such that patients are ensured of still getting the service they need because they have so many needs that we still have to take care of during this crisis. Cancer's not taking a time out during COVID-19. We can't either in terms of our care. But also making sure it's a system that works for the office staff and the doctors. And so I think this is an area in which we're going to have a lot of learning very rapidly. It's effectively a boot camp, but I think implementing telemedicine, making sure people having PPE, and then making sure that we're doing adequate testing for patients and providers, screening at the door, antibody-based and RT-PCR-based testing, depending on the availability of the test and the risk profile. I think these are key tenets in terms of keeping both the physicians, the staff, and most importantly, the patients safe. In my own medical practice, in particular for patients, the major change we've made has been aggressively adopting telemedicine as we've ramped up our own ability to test here and provide PPE universally so that any patient, any provider can have a mask to minimize risk. And so during that time, the best form of PPE really has been telemedicine to move visits virtually, to make sure that if some visits can be postponed until your region is kind of over its peak incidence. These are the kinds of things we've had to do. And I think there's been a lot of questions about treatment intervals and things of that nature. I think in my experience, the vast majority of patients have stayed on their treatment schedule. There are a couple who've not wanted to come in for their infusion treatments, and we've worked with them, but the vast majority understand what's at stake here and that we've keeping the infusion patients safe as much as possible with universal masking, screening, testing, I think really gives a sense of comfort. And in fact, I tell people that I have more screening and I feel more safe in the office setting than even when I go out to the grocery store, because I know the level of rigor in screening and the use of masks and the use of protection. And so I think where we made some changes has been, for example, in some of the patients who are on surveillance scans for cancer survivorship. If the range of scans per professional guidelines, such as NCCN or ASCO, suggest a 3 to 6 month scan interval, those patients that were getting scans closer to 3 to 4 months are now getting scans closer to 4 to 6 months, which is still well within the range of established data and professional society recommendations, but maximizes their safety by minimizing their contact points in terms of the health system. The other thing we've done is if a patient does have to come in, we've tried to basket all their appointments together. Now, this is something most medical oncology practices, and frankly, all oncology practices probably have already done for patients because many travel from far away, but just making the more salient point that you want to make sure the imaging, the radiation appointments, the surgical appointments, the medical oncology appointments, the infusion appointments, all are as close together as possible so that patients aren't having to go back and forth and maximizing their exposure to the health system in an uncertain time. And so many of the changes we made are structural, but in terms of the medical care, the surgeries, the radiation, the infusions that are needed are still going as scheduled, just with the understanding that we want to maximize their safety with utilization of PPE and appropriate testing. I think patients and even providers and staff who have a lot of anxiety right now, it's a difficult time. Our patients who are fighting cancer very rightfully have anxiety already to deal with COVID-19, both in terms of how the physical distancing can affect social distancing, your ability to physically be close to people that are your support network, also people's jobs. This is as much an economic crisis that's come from the pandemic as a health one, and how that affects people's finances, which may already be stretched. I think this is as perplexing as anxiety provoking a time as we've seen. And so the ability for us to provide for our patients, not only medically, but more holistically in terms of their care, I think is important. So one of the things we try to do is to make sure the patients know we're here and we're always available. We're only a phone call, now a teleconference video call away in terms of telemedicine, so they don't feel detached, they don't feel alone, because the last thing a person needs with all those aspects going on, both medically and financially, is to feel alone on top of there. And so we make sure to touch base with patients, call in, have teleconferences, things of that nature. And then the other thing is making sure the patients have appropriate psychological care, which is a specialty that actually is slightly more attuned to televisits. And so making sure they're able to reach out and have those important discussions with their psychiatry and psychologic experts. I think in terms of medications that are needed at this time to support patients in terms of antidepressants, anxiolytics, things of that nature, we're trying to be very judicious in terms of getting them to the patients, of course, but making sure we don't try to just mask the problem with medicines, because this is something that really, as much as we talk about social distancing, it's social proximity that can help as much in terms of resolving these issues. And so making sure people feel connected to their doctors, making sure they have access to their psychiatrists and psychologists, and then supplementing as needed with the medicines that are needed are the main areas we're trying to make sure patients feel supported in this extraordinarily difficult time. And so one of the things we've learned about COVID-19 is we got into this together, so to speak, in the sense that the virus spreads from person to person. And so really the only solution is for us to work together, both in terms of physical distancing to minimize the spread as we ramp up testing, ramp up PPE, ramp up contact tracing, but also in terms of just supporting each other. And I think there's no group that's as supportive of another group in terms of just being virtuous than the patient advocacy groups that take care of other patients in my field in cancer, and help provide information, resources, referring patients to the right place to get their answers. And so I think just continued education is hugely important. And these efforts are probably more important now than even they were before, when they were hugely important back then, because patients are feeling a bit alone, at least some of the patients I've talked to. It's a very difficult time in terms of their medical care, finances, that they need. It very much is now a risk now, right? The closer you are to people, the more risk you have of getting COVID-19. And so that's a type of psychology that's very dangerous right now, though medically needed. And it's something that the medical community, patient advocacy groups can really help by virtually being there, calling in, televisits, checking in with people and making sure that they feel connected, because as physically distanced as we may have to be, being socially close is the way we're really going to get out of this. I think the other point is anytime there's a crisis, there is the power of myth that gets spread. I've heard it from my patients. I actually encourage my patients to tell me that, because I can be honest. One myth I heard was that patients with cancer were going to be pulled off ventilators, even if they were cured, in case there's a ventilator shortage. I told the patients, that that's not an issue. No one's been put off ventilators. There are plenty of ventilators in the vast majority of the country, even in New York when they needed it. Ventilators were sent. 2 people were put on the same ventilator if needed. Other machines were used as substitutes. So, it's important to let your doctor know what you're feeling, because what you read on the news, oftentimes the doctor may or may not have access to that information or how seriously you're taking that. And we take it seriously because it affects your medical care, and we want to make sure to provide you with the best care, because sometimes when there's a knowledge vacuum, and with COVID-19 there are many knowledge vacuums because it came on so suddenly, we want to give the best data possible so we can take care of you. And I think both the doctors as well as the medical education community can help doctors take care of those patients and make sure these myths don't lead to things that can hurt patients, which is something we definitely don't want. Our cancer patients are already dealing with enough complexity, let alone to have to deal with some of these medical myths that go around that are spread like wildfire in a vacuum like this. I think this is an area that patient advocacy groups and doctors can work together to make sure that the true facts get out and we keep our patients safe. One aspect with COVID-19 is we're all desperate for a treatment. Having the treatment just be social distancing, which really is a preventative aspect, is problematic. I think all of us have gotten stir crazy. Many of us have financial issues related to this. And so I hear people, I understand how difficult this is. But if you look at all the treatments that have been proposed, none of them have been a panacea. In fact, if any of them were as effective as we thought they were in terms of pills or some of these other therapies being espoused online or even by some very public figures, we wouldn't really be having issues. It'd be very easy to take these pills, but sadly they're not as effective as we think. And so as you find news and as you get information about this pill as a cure for this part of COVID-19 or that, it's really important to have that discussion with your doctor, because many of these now are prescription. I have no doubt there'll be some herbals and over-the-counter type approaches that'll be espoused, or people told to hold certain medicines because they increase the risk. And so one of the things is, before making any big changes like that, it's important to talk to your doctor, because many of these are not actually founded in any truth. And sometimes holding a medicine or taking it over the counter can interact with your therapy in very significant ways. And so just it's important to get all the information. We're all looking for a treatment and a cure for this. We all want this to work. But with everything that's out there, it's important to separate the truth from the noise. And I think your doctor is best capable of doing that. And there's no question that is too far removed in terms of us wanting to answer, because it's important for us, for patients to be on the best therapies and continue to do so during this very difficult time.